Welcome to Lecture 5 featuring the Virtual Intelligent Sonographic Assistant or VIS-Assistance. Today we're diving into how this cutting-edge technology transforms fetal cardiac imaging, helping you capture these critical views with precision, speed, and confidence. So let's get started. VIS stands for Virtual Intelligent Sonographer Assistance. It's a smart imaging protocol designed to enhance your diagnostic workflow by automatically generating adjacent or neighboring planes around the primary diagnostic view. This allows you to explore the surrounding anatomy with minimal effort, especially helpful when you're assessing complex or supple structures. It's also incredibly useful when the initial diagnostic plane shows anatomical variations or isn't optimally aligned. In those cases, this assistance helps refine and improve the image, giving you a more accurate and comprehensive evaluation, all with greater speed and consistency. So when should you use VIS-Assistance? It's most useful when your diagnostic planes needs fine-tuning, maybe due to a supple anatomical variation or just less than ideal image quality. That's your cue. Now here's how to use it step by step. First, select the diagnostic plane you want to improve. In this example, we will choose the stomach plane. Then click the VIS-Assistance button on the left-hand panel. You will see guidance pop up in the VIS navigation panel at the bottom of the screen. Just follow these prompts. Once you've reached an optimized volume, post cine, then bookmark the improved plane. You can save up to 4 planes. After viewing your bookmarked options, choose the best one and hit Update Diagnostic Plane. That updated view will now replace the original in your set of 9 standard plane, and just like that, your image quality and diagnostic confidence gets a solid upgrade. As you can see in this stomach plane, the stomach is not optimally visualized because of its poor filling, so we tried to obtain a better visualization of the stomach to confirm normal size. Why does this matter? Once you update the diagnostic plane, the optimized view automatically replaces the older one in your 9 plane set. No extra steps, just better data. And here's the key takeaways. Improved image quality means better clarity, which leads to stronger diagnostic confidence and more accurate assessments. It's all about seeing more, guessing less, and making your evaluation count. Up next, let's look at how these optimized planes can actually enhance clinical interpretation in real-world cases. Now let's break down the 9 standardized diagnostic planes that the 5D Heart protocol generates. These views from the backbone form the backbone of the thorough fetal cardiac assessment. They include the 3 vessel and tracheal view, giving us a snapshot of the upper chest vessels, the 4-chamber view, the classic go-to for heart chamber structure, the 5-chamber view, which adds the aortic root to our perspective, the left ventricular outflow tract, focusing on the pathway from the left ventricle, the short axis view of the great vessels, which also covers the right ventricular outflow tract. The stomach view, important for confirming situs, the ductal arch view and the aortic arch view, both critical for evaluating major arterial pathways, and finally the vena cava view, rounding out the key vascular anatomy we need to assess. Together, these 9 planes help us get a complete, reliable picture of fetal cardiac anatomy. And that's a wrap on the 5D heart and the power of VIS-Assistance. We have seen how this smart tech can seriously level up your fetal cardiac imaging, making those tricky planes easier to get, faster, and with way more confidence. Remember, it's all about working smarter, not harder, and letting technology help you see the heart like never before. Thanks a ton for tuning in. Keep pushing those boundaries in fetal medicine, and don't forget, the best scans come from curiosity, skill, and a bit of tech magic. Catch you in the next lecture. Thank you.